Obesity has been linked with many chronic diseases, including high blood pressure, type 2 diabetes, heart disease, osteoarthritis, even certain types of cancer. In an effort to reduce this trend, health industry partners have come together to help Canadians take better control of their health. Here to tell us more is Dr. Arya Sharma, Director of the Obesity Network, a partner of Best Life Rewarded. Welcome to the show, Dr. Sharma.
It's great to be here.
Obesity is such a big problem now in Canada. Why is that?
Well, a lot of obesity comes down to people not having enough time. People are exhausted. People are rushing around. They're checking their blackberries very often. It's the first thing you do in the morning. It's the last thing you do before you fall asleep. Stress levels are very high, and you're constantly surrounded by food. And I think if you take people, increase their stress levels, put them in that environment, a lot of people are going to have a problem managing their weight.
Well, we all make New Year's resolutions to eat healthier and exercise more and, stop smoking and lose weight. But why is it so difficult for us to stick to it and then achieve those goals?
And that again comes down to time. People are not realistic about the amount of time that it actually takes to make those changes. Often when you think about making lifestyle changes, it's so much more about actually changing your life more than just changing your style. And people don't think about that. And so you make these New Year's resolutions not recognizing that they're going to cost you, 30, 40 minutes a day. And a lot of people just simply don't have that time. Or make resolutions trying to achieve goals that are not realistic, and then they get disappointed because they're not meeting those goals or not reaching those goals fast enough, and then you drop off again. It's easy to, make those, set those goals, but reaching them and making those changes in a way that you can stick with them, that's not easy.
There seems to be a coordinated effort right now to get Canada healthy, and so many non-profit associations, including your Obesity Network, Dietitians of Canada, Canadian Digestive Health Foundation, and many others, they've come together as a way to help Canadians get healthy. How do they all get on the same page?
One of the things that a lot of these organizations have done is partnered with people who can help. And one example of an organization that can help here is something called Best Life Rewarded. And what they do is they offer an incentive program that may be able to help quite a few people stick on track. It's bringing together all of the knowledge that these various nonprofit organizations have, each one in their own area of expertise, like the Canadian Obesity Network, bundle them together and provide that to consumers, but also offer some incentive to stick with these things. And I think that that's probably a formula that can be quite effective.
Okay, so how does a program like this specifically help Canadians get healthier?
A lot of these organizations have partnered with Best Life Rewarded because I think that they have an idea and could provide a service to consumers that I think is, could be quite helpful. Because a lot of people want to make changes, but often the problem is how do you stick with those changes, and how do you make sure that the changes that you're trying to make are the ones that have been shown to be successful. And so what Best Life Rewarded does is it takes a lot of the information that these different organizations have on the specific issues, presents them in a form that Canadians can understand, but also gives them that added incentive that allows them to actually stick with things. And I think that in the long term is probably going to be what will really make a change.
And you spoke of the importance of time management earlier in achieving sustainable, healthy goals. So how can Best Life Rewarded help with that?
Well, first of all, it starts with bundling information that's helpful to Canadians in terms of what it is that they should even be doing in order to improve their health. And it takes them through a process that allows them to judge, and ask questions like, do you even have time to do this? And is this something that you're likely to stick with? What's really novel about the program, I think, is then by adding on top of just giving people the information or ability to track their progress, to actually provide incentives. And that is something that I think is going to get a lot of people quite excited because, A, people like loyalty programs and you're collecting points on the way. And you can actually translate those points and those incentives into things that can help you be even healthier. And so it's the combination of having the right content, putting it together into a very novel type of platform, and then providing those little rewards on the way that I think will help a lot of people to really stick with some of those changes that they want to make.
Sounds fantastic. Thank you, Dr. Sharma, for such great information today.
It was a pleasure being here.
To find out more about how you can take personal ownership for your health, visit betterlivingtv.ca/health rewards.